Hello, everybody, and welcome to today's webinar from the Society for Implementation Science and Nutrition. My name is Mtutu Zimbuya, and I'm SISN's Chief Information Officer, and it's a pleasure to moderate today's webinar, Implementation and Science, a two-way street with lots of turns. We're all interested not only in what works to reduce malnutrition, but where, why, and how. And this requires going beyond research and programming as usual. The questions now that we're faced with are how to do it, how to implement the evidence-based policies and programs, how to make decisions regarding what to do when there isn't a specific answer as it pertains to the best implementation modality, and how do we continue to build evidence to implementation-related questions by building scientific inquiry into programs while recognizing also the real world of programming as it continuously evolves and in an uncontrolled environment, which can affect research plans, which often depend on controlled environment. We have a lot to learn from those at the front line who are conducting rich programming and implementation research at scale. And therefore, as SISN, we welcome today's presenters, Pooja Pandey and Kenda Cunningham, both from Helen Keller International. And we're grateful for their willingness to share their experiences, the challenges, and lessons learned from the Suaahara Good Nutrition Program in Nepal. Just a few housekeeping issues before we get started. If you have any questions during the presentation, can you please type them into the question box in your GoToWebinar control panel? You may send in your questions at any time during the presentation. Then we'll have a Q&A session at the end of the presentation, and I will pose as many of the questions as possible to our speakers as time allows. If you experience any technical issues, please also type your questions into the question box. We have staff on hand who will help you address these. Note also that we're active on Twitter and encourage you to chat and engage with us through our Twitter hashtag, which will appear in the chat box, the hashtag InvestInIR. And finally, a recording of the webinar will be made available after the session. And now, without further ado, I would like to introduce Pooja Pandey and Kenda Cunningham. Kenda is the Senior Technical Advisor for Integrated Nutrition and Monitoring, Evaluation and Research for Suaahara II. She holds a Doctor of Philosophy from the London School of Hygiene and Tropical Medicine in the Faculty of Epidemiology and has a decade of experience that spans research and implementation related to maternal and child nutrition. She has also published extensively in nutrition and food security journals and sits on the editorial board of the journal Maternal and Child Nutrition, and is also the Recruitment, Engagement and Outreach Counselor on the SISN board. Pooja is the Deputy Chief of Party for Suaahara II. She has an MSc in Public Health, also from the London School of Hygiene and Tropical Medicine in the UK, and has been working in Nepal for more than 18 years in the field of public health and nutrition programming. Her main interests focus on addressing multi-sectoral dimensions of malnutrition in South Asia. Without much further ado, I'll hand it over to you, Pooja, to get us started. Thank you.
Great, thanks, Madhu. Good evening and good morning, wherever you're listening from. Kenda and I are really pleased to be sharing our experience on implementation science for Suaahara program. For the webinar today, we will begin with a brief overview of the program, our monitoring, evaluation, and research system. We also want to be very open, and we want to list out some of the key challenges and tensions we face every day of our work as an implementer and as a researcher in our quest to transfer evidence into action in real world contexts and settings. It's a no-brainer that we need data to implement evidence-driven program, and without a doubt, Kenda's research expertise has immensely improved the quality of Suaahara's implementation, and we would not have achieved some excellent results we're seeing now without the data that our monitoring team provides us. However, in a real world context where move and change, our program needs also changes, and my job as implementator is constantly to deep dive and look beyond program outcome and output indicators. We will share some lessons learned on how to navigate the research and implementation tensions to bridge evidence to program gaps. And we were hoping to give you more solutions, but while we're making the presentations, we ended up listing out more questions than we need to learn more about. So before I begin, here's a quick overview of Suaahara program. Suaahara II is a USAID funded 5-year multi-sectoral program. The program operates at scale, meaning we cover 42 out of 77 districts in Nepal, covering 900,000 households, with a goal to reach 1.5 million women and children within the first 1,000-day period. Suaahara's intervention spans across many sectors: health, nutrition, wash, agriculture, governance, education, and the project has a strong focus on social and behavior change, gender equity, and social inclusion. So this slide shows about the scale of Suaahara and the different integrated delivery contexts that we operate in. In terms of just in terms of numbers, what scale looks like in Suaahara, we work with a combination of government structures, health, agriculture, local government. We partner with 40 local NGOs and across the country, and many local private providers, with a hope to cover 60% of the country. We use a district-wide model in 42 out of 77 districts. We work with 27,000 female health volunteers across Nepal, who are the backbone of a public health system and Suaahara's. We have trained more than 15,000 health workers. We work with 4,000 village model farmers. And in order to create an enabling environment at a local level, we work with more than 7,000 multi-sectoral nutrition, food security, and WASH committees. And you can see from the slide, our goal is to reach 1.5 million women and children in their 1,000-day period. But to get to 1.5 million, we have to reach more than 10 million households to find these women. So the big scale-up challenge for Suaahara was, how do we achieve population coverage, high population coverage in different geographic settings across sectors? And we work from hills and mountains and Tarai. We not only had to achieve high coverage, but also ensure quality and equity while maintaining scale. And also we hope that long after Suaahara is gone, our programs, activities are sustainable. So we had a very ambitious implementation goals. But our first challenge was, how do we deliver these interventions in different sectors, in different contexts? And there was a lot of implementation questions that we discussed as a program team. How to reach target population? And once we rolled out our program, the big question was, are we reaching the target population? Why do some communities participate? Why don't some communities don't participate? What is the effectiveness of implementation? How do we implement consistently, but with variation by context? Because we work in different geographic settings, different cultures, there are different languages. And our second challenge was, how do we package these evidence-based interventions and scale up in 60% of the countries? How do we package interventions for food insecure households? How do we package intervention for disadvantaged households, because the barriers are so different? We needed answers to so many implementation questions, but everything that we needed was not there. And so we used a combination of scientific evidence. We're in year 9 of the program, so there was a lot of program experience within the program team. And in many cases, we applied our best guesses. And some of the implementation science related questions that we keep discussing even in year 9 is, what are the cost and time saving targeting strategies for a large scale program like Suaahara, where we operate in 60% of the country? We know that working with the government of Nepal health system is key, but how can we effectively package nutrition interventions so that quality is not compromised? What are the trade-offs on program integration? So these type of implementation questions we talk about every day, and we look for evidence, but we are surprised that there are very little information on these sort of questions. I just want to walk through an example of SPC package. So this slide shows the SPC package, the social behavior change package that Suaahara uses during the first 1,000 days. So we know that globally there is a lot of evidence on effectiveness of interpersonal communication for behavior change. For Suaahara, through our internal monitoring and research system, we also have data to show that if a woman is exposed to interpersonal communication and listens to our weekly radio program, the chances of behavior change is there. So IPC and mass media is a foundation of our behavior change work. But we also know that it is very resource and time intensive, and we need a lot of frontline workers to do interpersonal communication. And the other challenge was also the scale of the program, and we did not have the luxury to have, a lot of frontline workers. We still depend on around 1,000 frontline workers to do our interpersonal communication in 60% of the country. So we had to look for different platforms. And one of the best guests we used to design the SPC package was the SMS campaign, where our data showed that 96% of the Suaahara household actually own a phone. And we thought, okay, this is a good way to reach these households to reinforce different messages. But as we implemented our SMS campaign, a lot of issues started coming. And that brought in a lot of questions that we had to reach out to Kenda for more information. And we will talk about it later. And there were other implementation questions that we as a program team was interested. Number one, how do we reach households efficiently? We know that IPC is important and we have to do it, but what is the ideal number of home visits needed to achieve behavior change? Can government frontline workers do IPC effectively? And out of all the many social and behavior change activities, which interventions should I prioritize with a limited budget and in the limited amount of time? So Kenda gets asked these questions all the time, and now I'm going to hand over to Kenda to talk about how she designed a monitoring, evaluation, research system to answer these questions. Over to you, Kenda.
Thanks, Pooja. So I think as everyone can see in Suaahara land, the programming team is quite ambitious with trying to do a lot of different activities across a lot of different sectors and across 60% of the country. And so the challenge we had was to develop a monitoring, evaluation, and research system that could try to help guide some of these program activities. So the first challenge that we had was at the end of Suaahara I, as Suaahara II planning was beginning, there were a lot of different questions that actually are mostly related to implementation science. And external stakeholders still frequently ask us, Nepal is famous for its ODF campaign and for massive reductions in maternal and child undernutrition. And what of these changes over the past 5 to 10 years will be attributable to Suaahara? Is this model cost effective? Is it sustainable to have 1,000 frontline workers out in the field? The government also frequently asks similar questions, but they also ask, how does Suaahara contribute to our national indicators? How can we use your data into our HMIS system? Is this kind of large data collection system sustainable? And as Pooja mentioned, the program teams have lots and lots of questions about reach, coverage, and actually sub-activities, because she explained 4 components of the SPC campaign, but each of those 4 components has about 10 to 15 sub-activities. And program teams actually end up being very interested in reach of each of those sub-activities, which, as you can imagine, can be quite challenging to measure. And program frontline workers are asking for job aids and data to help them know where the pregnant women live, where the children of different age categories live, because the way they've been trained is to do needs-based counseling models based on stage of 1,000-day. And then the M&E teams are often asking about which systems we're going to use, which types of research questions we're going to answer, what software we should buy, and biases and other kind of data collection and data analysis type questions. So with this, we realized that different stakeholders actually have different questions, and that we really can't expect one data set to be used to answer all the different questions, and that there is a need to invest in a monitoring system, an evaluation system, and a research system separately. So in short, we say different people have different data needs and wants, and these require different approaches. And that, coming up with that alone and getting a staff of over 1,000 people across the country to understand that, and to understand that one data system couldn't do everything, but that the same way program teams need to prioritize, we also had to prioritize data that fits program needs, that answers donor questions, and that implementers can use. And then secondarily, hopefully include in those data systems lots of additional questions and variables so that we could answer more research type questions. So I'll walk through the 3 components. The first component that we needed to create was a monitoring system. And as you can see here, the first challenge was to create a monitoring system that captured all of the input and activity data. So everything that's happening in different districts at different times. We talk about an annual work plan, but there are actually 42 annual work plans with lots and lots of sub-activities. So all of that goes into our DHIS2 and then into the USAID TrainNet system so that we can identify who was reached by each activity. However, that information is just at the input and output level, and there's a need to monitor behavioral change. And so the second challenge was, how can we generate evidence that meets our annual donor reporting requirements, which for us are nearly 90 indicators that we need to report to USA, primarily health, but crossing all the different sectors that Pooja mentioned. And we're also interested in going beyond the donor required indicators and actually to look at variables along the program impact pathway so that we can understand where changes are happening and where changes are not happening. So the obvious is exposure, knowledge, and practice, but also other contextual, potentially confounding factors or potential factors that are contributing to program success. So that is helpful, but there was a lot of concern, especially among program staff and field-based teams at the end of Suaahara I, saying we operate in extremely different contexts with different geographies, different ethnic groups, different languages, and we really have a hard time identifying with a population-based survey sample and knowing are our WASH indicators or our agricultural indicators moving at the same rate or faster or slower. And so there was a demand for district-specific data sets. And so what you can see here is that while input and activity monitoring data is collected throughout the calendar and annual surveys happen in the same season every year, we complemented this with what we consider our internal monitoring checklist. And so field staff have a mobile phone, and along with their day-to-day activities, when they're doing home visits, they also need to collect checklist data. And that data, we think we have a sufficient sample at the quarterly period, which is why you see the red arrows. And every district can then log into the DHIS2 system and see their own dashboards. And while this sounds great for the district team, this actually was quite a challenge, because in order for this not to just be purpose of sampling and for it to actually be rigorous data that we felt comfortable using to guide program decisions, we first needed a sampling frame. And so that required going door to door to register all the households. And that, we'll get to that a little bit later as well, because that mapping exercise needed to be integrated. Otherwise, our field staff would have just been doing monitoring and no programming. So we implemented how we developed our sampling frame for monitoring as part of the home visit approach that we use. And we also, that was then an opportunity for counseling, identification of SAM and MAM children, promotion of our Panchanama radio program, and collection of the mobile phone numbers that were later used for the SMS campaign. And so it was kind of an integrated approach to be a monitoring and a program activity. So what you can see on this slide is our recognition that while the monitoring system enables tracking of key indicators over time, and we've even invested in a lot of interesting regression modeling to allow us to look at some of the exposure to different program components and outcomes, we're quite aware that this data is collected exclusively at intervention areas and without a counterfactual. And so it's really hard to answer questions of attribution from our monitoring system. And what's been designed is an evaluation that was actually started in 2012 during Suaahara I. The end line that was originally planned was canceled due to the earthquakes of 2015, but we are planning to do the end line in 2020. So this is a quasi experimental study with a matching design to be able to look a little bit deeper at what's going on in comparison areas and to answer some of the questions around, did Suaahara actually contribute to improvements in nutritional status? But we've realized that the impact evaluation, which will primarily be at the household and health facility level, would also not capture how the program has evolved over time to really strengthen Nepal's policy environment and community systems for multi-sectoral nutrition. And so this will be complemented by community and policy level qualitative evaluations. And lastly, the third part of the system, the data system that we have, is research. And as I mentioned at the beginning, for us, it's been quite important to have the monitoring system be considered separate from the evaluation system and separate from the research system. And we have a lot of ongoing research, but we have three primary areas that I can talk about as a sample of what we do for our learning agenda. The first is around adolescence. So we started a panel of adolescent girls, and we've now just completed data collection last week on the third round of this panel data. And our question is really, how do you reach adolescents if you want to have a multi-sectoral nutrition approach? And what's their current level that you need to build upon? And at what age are you able to intervene on certain key components? And what's different between a 10-year-old and a 17-year-old and a 17-year-old who isn't a mom versus is a mother? And so, as you can see, the panel is designed in such a way to really answer questions that enable program design of interventions in the future. The second area, as Pooja mentioned, we've added SMS as a key component of the SPC overall strategy for 1,000-day households, but there are a lot of questions around SMS. So this is a picture taken very recently and trying to do listing for the baseline for an RCT that we're running to see if you can add SMS onto a pre-existing multi-platform intervention, and if that would be an effective means of actually improving diets by sending reminders and motivational text messages. This has been complemented by 3 rounds so far of qualitative data to help guide our thinking around what types of messages to send, audio versus text, how many languages, how often, who in the household should receive the text, and so on. So as Pooja mentioned, those qualitative studies are really to guide the program team. And that's an example of the third component of our research portfolio, which is that we do a lot of formative research that's mixed methods to try to deeper understand what are barriers and facilitators for key behaviors. And one of the things we really struggle with is how much is too much data and how much is too little data, because we have lots and lots of behaviors we want to move, and we have lots and lots of different activities that we need to generate evidence on. But those are kind of the 3 overarching research areas. So we also wanted to show a little bit of how we use the findings and remind you that at the beginning we were talking about how there are different stakeholders who have really different questions. And a main advancement in Suaahara II was trying to use data to guide program decisions. And we don't just mean Kathmandu or manager level decisions, but we actually mean field level decisions. So the checklist that I was mentioning that our field staff collect as part of the internal monitoring system, that data in ComCare on a smartphone is automatically linked into our DHIS2 dashboard system, which the screen might be hard to see here, but these are thematic dashboards. And as an example, you can see the arrow goes up, and somebody that's sitting in one district can choose to click on, for example, the agricultural dashboard or the health dashboard or the SPC dashboard. And what they would get is their district-specific data and to try to see which indicators are moving and which indicators aren't moving, and to be able to do micro-planning on a quarterly basis. So that's for the field teams, an example of how we use the findings on a regular basis. And then we've also created a variety of materials where we try to synthesize key findings from our monitoring system to be able to feed into government data systems, because it's an ongoing request that we receive. And this is an example. So Nepal, about 2 years ago, went through a decentralization process where power and funding was massively shift to the local level. And while we couldn't disaggregate our data to the municipality level because it wasn't powered at that level, we could aggregate up and feel confident to provide estimates at the provincial level. And so we shared demographic data, but health data, nutrition data actually from the DHS, so everything is kind of referenced. And this is actually a leaflet, and when you open it up, the inside has the other sectors that we work on, so some agriculture data, WASH data, family planning, and so on. So how do we go about doing this and using our findings to guide program performance? So we're constantly measuring a wide variety of indicators, and then we analyze that data, and we have lots and lots of workshops where we try to build skills for our staff, both at Kathmandu and across the country, to understand the data, understand the findings, what it means, when it's sufficient to actually act upon. And if we feel that it's sufficient to act upon, then we kind of correct the program course by feeding back this data into work plans and revised work plans. But we also then prioritize areas for deeper dives and things that we need to do additional qualitative research on or quantitative research if we feel we're not confident moving forward in one direction. And I think the point to make is this is a loop and it's a never-ending cycle. So Suaahara could be in year 20 and we would never be finished with this, because we constantly learn lessons, we tweak activities, and then we just have new questions and so on. And an example, I can give two examples. One is that early on we realized that while we knew intuitively that 800 frontline workers would be insufficient to reach 1.5 million families in the 1,000-day period, and as Pooja mentioned, you have to go to every door to even find the households in the 1,000-day period. We were able to do some modeling within our monitoring data that really showed that if we just had more frontline workers, our exposure could go up and the odds of obtaining ideal behaviors would also increase. We also had WASH data that we sat and strategized with our WASH team on that really showed that although we prioritized 6 key times for hand washing with soap, that what was lagging were the before, not the after behaviors. So before eating, before feeding a young child, and before preparing foods. And we then moved and we added program activities, for example, distribution of bibs that said, did you wash your hands before feeding me? Because we realized that if we moved the 3 before hand washing times, we would move the overall indicator as well. So that's just some examples. There are hundreds, I think, that Pooja could share, but I think we want to jump now into what some of the challenges have been from having a really complex program system and a really complex monitoring, evaluation, and research system. So back over to you, Pooja.
Great, thanks, Kenda. So from a implementer's perspective, there are a number of challenges, and some of the top challenges, you can see it on the screen. I think for me, the implementation research should always be embedded in the program. The implementation science research should be done in the context of program, and it should influence program implementation. And while prioritizing implementation research questions, it's important that we engage with diverse stakeholders, and not just policymakers and program managers, but also frontline workers, to get different perspectives. And who sets the agenda and who chooses how implementation science is defined is also equally important, and it should be a joint effort. I've always wondered why the results that are vital to improve programs and policies are always layered into complicated frameworks and complicated jargons, and peer-reviewed publications are prioritized most of the time. And as a programmer, as an implementer, what we are really interested and what we really want to learn more is around the delivery systems and how complex multiple systems interact. How do we work with complex changing government systems? What are the enablers and barriers for implementations? And more than just X intervention led to Y behavioral outcome. the other thing, other challenge or tension is sometimes there is limited, while doing implementation science research, there's limited understanding of the environment, the complicated environment that programmers actually need to work in, and many factors, implementation factors, are not measured or documented. So, the organizational capacity, the technical capacity of the CBOs, the NGOs that actually deliver the interventions, the government's delivery capacity, the political context and policies, the various donor requirements, the funding limitations, and these directly affect program implementation and directly affects quality of implementation. And I feel we should understand it better as a researcher and also measure it. And sometimes, we researchers also tend to overlook how much time and effort is needed to actually implement. Interventions don't work automatically, and there are many steps that, as a programmer, as an implementation team, we need to go through. And there's a great deal of thinking, compromises, and trade-offs that we go through while finalizing the implementation roadmaps. And this should be documented. There's also challenge, in the point number 3 that I want to talk about is to achieve one result. Multiple program activities should happen at multiple levels, at household level, at community level, at health facility level, at the policy level. And we sometimes it just, okay, this intervention was implemented this way and gave this result. But I think we need to look at, because all these levels are connected and interlinked, and I think we should have a more broader overview. I also feel that from a research side, from an implementation science perspective, we, for program team, we need more intervention options. We need, the non-negotiables. If you're scaling up a MIYC and, maternal child infant package, these are the non-negotiables. You have to do, there's no compromise. These are some of the important things, or, these are the nice to do things. So I think these sort of menu of non-negotiables and menu of interventions that are evidence-based will be very, very helpful for programmers like us working at scale.
So because Pooja and I have the privilege of sharing the same room with each other, we talk about her frustrations and my frustrations quite often. And we've recently been kind of strategizing around what can both sides do better, and the reason for this webinar was to really try to think through with a broader community, what are these nuanced tensions and how can we take this conversation and the opportunities to the next stage. So I think one of the things that we've really learned is that we need to engage early and earlier, and really often with implementation teams, because on the research side, we need to learn to listen more to exactly what questions implementation teams are asking, and push them to be able to articulate what they want to know and to prioritize research questions within the program cycle. So some of the questions they have, actually you can't answer once you're in year 2 or 3. You have to have answered prior to year 1. And so it's kind of important to keep a lot of open communication. The second is that even though you end up with a lot of people on your M&E team or collaborators who are really interested in doing different types of manuscripts and analysis, that has to be secondary to prioritizing during design and during analysis what the program teams need to be able to be effective. And I think the third thing is there's a lot of times where these intangibles that Pooja talks about are really about leadership, about program management. They're almost more about organizational management. And I think we need, from technical side, as researchers, to also bring in the methods and the experts from that side of things to complement some of the more sectoral-based research that tends to happen, so that we have kind of more nuanced ways to merge these quantitative and qualitative findings across disciplines. We also have to be quite patient. I think, you know, a major frustration sometimes is about changes that happen with programs along the way. But at least now, moving over into the NGO world about 3 years ago, I have a deeper appreciation of why those changes happen, and that not all of those changes are actually preventable by the people implementing the program, because there are lots of factors beyond that one organization's control, and that's magnified when you start talking about a program like Suaahara that has 8 sectors and more than 45 sub-partners that are implementing. And so I think patience and assistance to document along the way, lots of listening, lots of meetings to try to understand the complexities and negotiate is quite important. And the last thing that I've really learned through doing this implementation science work within Suaahara, and that I think we could all do a little bit better at, is simplifying the methods. So as multi-sectoral programs continue to grow, the questionnaire length continues to grow. Everyone wants to measure everything, and the question is, what's enough to guide what we're doing? And then presenting our findings in ways that are actionable and disseminating them in really user-friendly ways that can help guide the programs on a day-to-day basis. So now that Pooja has shared her implementer side perspective about frustrations, I'm going to share what some of the challenges are from the scientist perspective. So I think the first thing is that oftentimes there's kind of unclear expectations, or what I consider to be moving target expectations about what a study can do and will do, and unrealistic timelines, unrealistic expectations for a particular data set. And so I think it's really important that we are very clear, not only with implementers, but also donors, about what can be expected from a particular study and within a specific timeline, so that you're not being requested to turn over data analysis 2 days after the data collection has started, unless people are willing to risk data that hasn't been cleaned or managed properly. So I think that's something that's really important for implementers to understand, is just how long and tedious actually doing research can be. The second thing is that there's often shifting budgets, modalities, staffing, etc. And while some of these things are not controllable because they're from the donor side or the government side or headquarters perspectives and things like that, some things could be more allocated and put into a box. This amount of budget for this research study will not be later changed and reprioritized, or this staff that we're asking you to do a study on, we won't change the staff, making the study kind of impossible. And so I think, again, that goes back to open communication and regular conversation. And the third, which I talked about a little bit earlier, is I think there's a lot of tendency to expect that you can just do M&E as a lump sum activity. But there's a real need to understand that monitoring is distinct from evaluation, distinct from research, not just in how we can interpret study findings, but in how you need to do hiring and staffing of those different components if you want to embed them into programs, because they each require a different set of skills. And people might come in with MIS experience to help you set up a DHIS system, or people might know how to program ODK, or people might be good at training in a survey firm, but they might not be good at data analysis, or vice versa. And so hiring for specific activities within M&E and R, the same way that you hire for specific implementation thematic areas, is a quite important thing. And the last thing I think is tends to be a lack of investment and oversimplification of how easy it is to just have the results and run with it. And I think we need to build in the time in work plans, in proposals, to have a lot of conversations, thinking, discussions around using the data at all the different levels. So a frontline worker, the data they need to use for their day-to-day is very different from what someone in Kathmandu needs. And we tend to just try to rush and throw the data in on the sides. And I think really taking a step back is quite important. So these are some of the challenges and frustrations I've had. And I think Pooja has some comments from the implementation side.
Thanks, Kenda. So I think from a implementer's perspective, I think we can do a lot better. It is a joint responsibility to promote evidence-focused program implementation. I know that one of the most frustrating things for researchers working in program setting is there's constant change. But I think we as an implementer should do a better job of being very clear about what we want from the design stage, about the implementation priority, about the priority research questions, and stick to it. But then if things change, then being communicating it on time and discussing the programming challenge, changes, and sharing how we've sort of adjusted the implementation plan would be very important. And I think we should also regularly sort of meet, involve the implementation scientist in major program planning meetings such as work plans, workshop, so that they also understand how we prioritize, what are the trade-offs, and how we revise budgets, how do we prioritize different activities. So there's a few concluding thoughts, and none of the key takeaways are researchy. It's more about how we work together, how we communicate with each other. I think the first is also the expectation from different stakeholders, from the government, from the donors. We should expect our work plans to change if we want to be evidence focused, because information keeps coming. There are different changes that happens. We should also encourage failure stories so that we can learn from it, not just from what is working, but what is not working, so that we don't repeat it. If there's evidence that some of the program activities are not working, and for example, the cascade model of like training government stakeholders, then we shouldn't be doing. We should look for different other options. Donors and government stakeholders should also understand that it takes a lot of time and effort to change culture. The second point I really want to highlight is, implementation science, and this partnership between researchers and implementers are all about trade-offs and compromises. And there are many things we're interested to know, many things that is needed in a program settings, but within the time frame and budget and donor requirement, what are the essential things that we have to do to achieve our results is going to be critical. And you have to constantly look at, ask ourselves, is it relevant for the program people? Do we contribute to the government priorities? Which is better, implementation priorities, or are they trade-offs on publication? So these are some of the trade-offs and compromises I think we need to communicate and constantly discuss about. And I think one of my most important learnings is, we should never underestimate the intangibles, which we cannot measure. To make a program to happen, and as I said before, intervention don't just happen automatically. You need people, you need systems, and teamwork, if leadership, modeling, open communication, these are all the intangibles, unmeasurable things that is very critical for a program success, and we should not underestimate this. So this is our last slide. There'll always, as a program implementer and Kenda as a researcher, we keep discussing. I think there'll always be tensions, and it will be murky, but we learn so much from each other, and it can be a lot of fun, and it's totally worth it. And it's only by working together and by understanding each other's perspective that we can really truly make a difference, and we can learn how program intervention actually operate in real world setting and have the best shot at reducing undernutrition. So good luck to us. And we would really like to thank the government of Nepal for their leadership. I really would like to also acknowledge USAID mission support in Nepal. They've been a really fantastic funder, a partner, and we have changed our program description, based on the evidence that's coming in, based on the annual survey reports. We've changed our work plans multiple times. So we really applaud USAID's vision to promote evidence-based programming in Nepal. And we also would really like to acknowledge our consortium partners, CARE, FHI 360, ENFO, Equal Access, Nepal, NTAG, and VDRC for their collaboration and support. So thank you very much.
Hi, I'm Duduzi back again. That was a really fantastic presentation. Thank you. Thanks to you both. So at this point, it's time to hear from our audience, and I see that some questions have been coming in, which is great. So I'll start off with a question that I think is best directed to Pooja, but you can answer it as you will. From Steve Miller, the question is that with so many interesting questions that come up from almost daily that could inform SPCC programming, how does the implementation team decide which questions need to be validated by Kenda's team and which are more best guesses?
Okay, so great, thank you. So as I mentioned before, I think we use a combination approach. So I can give you an example. So one of the things that Suaahara we really want to improve and is the consumption of animal source food among children. And through our annual survey, our monitoring data, we are finding that that's a very, very difficult indicator to move. And the research data, annual survey data showed that different contexts, there are different barriers. It's not just supply. There's cultural issues. There's a lot of diet related issues. So Kenda's, I shouldn't say Kenda's data, but the research data showed that it is a big problem. But then we needed to dive deeper into, okay, why do some people eat eggs and why don't some people? And so we used a combination of insights. We have like we mentioned before, 800 frontline workers who interact with mothers every day. So their insight is also very, very helpful. We also look at many other campaigns that's going around looking at different research findings. So it's truly a combination of evidence, field insights, and we try to triangulate from different perspectives.
Thank you, Pooja. Much appreciated. Let's move on to the next question, which is from Kay Gordon. The question is, how do you control or adjust for confounding in an uncontrolled environment with a changing exposure? Over to you guys. Maybe I'll direct this to Kenda.
Yeah, thanks. I think it's a really great question. I think for looking at monitoring data with just doing kind of standard linear and logistic regression modeling, we control for as many of the contextual factors as we control for. And as Pooja mentioned, some of it's about triangulation. And so I think one of the beautiful things about living in the country where you're doing the research is you learn things like, oh, well, religion in Nepal, maybe you don't need to control for, whereas in another context, you would need to control for that. Because in Nepal, the religion is so intermixed that no matter how they answer that question in the survey, Buddhist people go to Hindu temples, Hindu people practice Buddhism, etc. But caste and ethnicity might be really important. Or you might learn that in a lot of Nepal surveys, people control for agroecological zone like hills, mountains, and terai, but that actually that's not a purely geographical classification, that's a political classification as well, and that using altitude actually gets at what you're looking at better. And so I think the environment is changing all the time, and we try to measure as many of those factors as possible within our quantitative surveys, but acknowledging that there are things that are kind of harder or maybe impossible, kind of the unmeasurables Pooja mentioned. And the changing exposure and the changing activities, our annual survey questionnaire gets modified every single year, and it's part of how the program and MER team works hand in hand. And so to be able to look at exposure to Suaahara, you actually have to modify your questionnaire every year because the program itself is changing. And so As an example, in the first year, we might have asked questions around, do you listen to the Banchanama radio program? But now we have 4 different questions because Banchanama has expanded to be on Facebook, YouTube, mobile phones, radio listener groups, home, etc. And so I think it's a matter of constantly updating what you're measuring, but at the same time keeping enough consistency over time that you can generate variables that allow you to measure. So I think it's an unanswerable question, but that's the best we've come up with for dealing with it in the short run.
Thank you, Kenda. Our next question is from Vicky Queen, who starts off with a thank you for a great presentation. The question is, to guide future program design and cost needs, what percentage of the budget should ideally be allocated to adequately develop and implement a robust M&E system? But this is excluding RCT studies, and one that includes the very important implementation research that you've described today. So is there a percentage rule of thumb you can suggest? And related to this, do you think that funders will be able to cover those costs, as typically the desire is to put every single penny into program delivery? Thanks again, wonderful work done by the Suaahara team. Over to you both.
Thanks for the question. This is actually something we talk about a lot. It's funny, there seems to be an industry norm that emerged over time of 5 to 10%, and I think it does vary by donors. It's tricky to say in an integrated program, and I'm glad that you acknowledge that research should maybe be separately funded than M&E, because it really does require a different resource basket, so to speak. I think a few things that we talk about. One is that the resources devoted should be proportional to the program. So if you're not operating in 60% of the country and in 8 sectors and with 46 sub-partners, you probably don't need everything that we just talked about, but you could set up systems that have the same principles behind them at a smaller scale. The second thing is that we feel like it's money well spent, and Pooja often says that we should actually spend maybe 15%, because she calls it Kenda's data, but actually Pooja has much more of a love for data than I do. But it is money well spent, because what we have actually been able to do is move our activities in a way that can be evidence or science informed. I'm not sure about evidence based all the time, but at least informed by that. And it means that we're not investing in lots of activities that we don't have evidence behind, at least kind of field-based experiential evidence, if not kind of rigorous quantitative data. And the third thing is that we've actually saved a lot of money, because we realized a couple of different things. We wanted to roll out an SMS campaign in our original proposal to adolescents, but it turns out adolescents don't have phones. We also had planned to have a separate grandparent intervention, and our demographic data showed that households have changed over time. The household structure is different, and that grandmothers in 75% of the households where the program had reached, then the grandmothers had also been exposed. So it kind of didn't make sense to allocate resources that way. And so I think if you set up your M&E system properly, you can actually use the investment in M&E to guide programs. So yeah, stop there.
Thank you, Kenda. Any additional reflections from you, Pooja, on that important question?
We can move on to the next question, Madhu.
Splendid. Thank you. The next question is from Kelly McDonald. She says, great presentation and discussion of the challenges on both sides. Since it takes time to collect, analyze, and interpret data, how can research findings be provided for program implementation in a timely way and not get caught up with reporting preliminary findings that may be influenced by the interesting and novel findings or insights than the more thought out interpretations?
Yeah,
Over to you both.
So maybe I'll answer and then I give it to Kenda. So I think so great question. And as a Suaahara team, we've there are many behaviors we want to change, but we have prioritized 10 behaviors and 60 contact points where the 1,000 days mothers go to. And so the M&E team, what they do is after the annual survey is over, these are the sort of top line findings they provide to the M&E team so that we can start thinking about it. And we also, that data is also looked at from different perspective by agroecological zones, by equity quintile, by by where they live, whether they have access. So that itself is a very wealth of information for the program team to get started.
Yeah, the only other thing I would add to that is I think creating systems are really important. And so if you're trying to have immediate feedback, in year one with our internal monitoring system, we didn't have our DHIS2 dashboard set up. And so we were generating 40 district-specific PowerPoints and sending them. And that is extremely time-intensive to manage the data, analyze it, and generate the results. And so we invested in a collaboration in which a DHIS2 system was built, and then you can build linkage software that allows that analysis to be automated. Similarly, for our annual surveys, we do not recreate cleaning and analysis do files and data every year. Those do files are more or less consistent, and as I mentioned earlier, the questionnaire gets tweaked every year. Well, so do the cleaning and analysis do files and the dummy tables that we've set up to generate the results. But all of that work is done while the data is being collected. And so I think if you have systems and you're organized on your team, you can actually massively reduce the amount of time between receiving the data set and being able to give feedback.
Thank you both for that answer. We are coming close to the hour, but we'll have time for just one more question. We'll take the question from Kirk Dearden, who asks, thanks so much for the excellent presentation. Most webinars I attend don't demonstrate this level of transparency about challenges we all face. I've been working on an integrated nutrition project in Tanzania, similar in scope to Suaahara's. One of the challenges we face is how to manage and effectively use massive amounts of data, more than several million data points. Data collection has assumed a life of its own. Despite hiring dozens of data entry technicians to address backlogs in data entry, we don't have the latest data for our donors and can't always use data for programs in real time. Have you had this problem, and how have you addressed it? Over to you both.
Thanks, Kirk, for the question. I think some of the answers that we just gave about creating systems are probably applicable here. The other thing is we don't do any paper-based data collection anymore. So everything electronic and investing in, for us, it was ComCare and DHIS2 and Stata, et cetera, so that those systems could be more established and not reinventing the wheel every time. And then the second thing is having priorities. And so we too have thousands and thousands of data points. We actually have gone door to door to more than 10 million, to register more than 10 million people into a server. But we don't need to analyze all that data to be actionable. And so for us, it has come down to really being clear on the priorities from the program team so that we can immediately answer those questions. And then as and when we get opportunities, which we do often because we've collaborated with London School, Hopkins, Columbia, IFPRI, and others, who are interested in particular parts of our data set to help us answer questions that are of bigger interest, then that can come. But the first immediate thing is to analyze those topics that have been prioritized by the program team rather than getting kind of overwhelmed and swimming in data, which we can appreciate that sentiment.
Thank you, Kenda. And thanks, Pooja. At this point, since we have to break, please note that we will look at the questions, all of the questions that have come in, and respond either personally or via our website if appropriate. So we'll regroup and discuss about how best to answer some of these insightful questions that that have come in. So on this note, I'd like to say thank you again to Pooja and Kenda. And thank you all for listening, hanging in here, and for your insightful questions. We hope that this webinar has been informative and thought-provoking. If you have any other questions or ideas for upcoming webinars, please don't hesitate to contact the Society at info@implementnutrition.com. I'll repeat, info@implementnutrition.com. Do visit our website to stay up to date on the Society's activities and to learn more about implementation science in nutrition and the various engagement opportunities that are available to our members. We're also active on social media and welcome your thoughts, your comments, and engagement through our Twitter and LinkedIn pages. Once you leave today's webinar, you will receive a very brief survey on the webinar, and we would appreciate if you would take a moment to provide your feedback. You'll also receive a follow-up email in a few weeks with a link to today's webinar recording and a URL to the PDF of the slides. On behalf of SISN and our presenters, thank you all for joining us today, and have a great rest of your day. Thank you.